Ask the MP. The Right Honourable is in the hot seat. Ask the MP with Farai on ZiFM Stereo.
Tuesday, the 8th of May, 2018. My name is Farai Mwakutuya. It is time now for Ask the MP, and we thank you so much for tuning in to ZiFM Stereo, my station, your station here in Harare, broadcasting on 106.4. Also available on the World Wide Web, zfmstereo.co.zw. Also listen to us via the TuneIn app. Follow us on Twitter, like us on Facebook, and elsewhere across Zimbabwe. Our frequencies at Chivu 99.8, Beitbridge 106.1, Kariba 105.3, and in Masvingo 96.1. I'll update you on other frequencies a bit later in this program. As always, on Tuesdays, we bring you this effort where we bring in different members of parliament, different civic society organizations, and discuss issues that are under debate, under discussion in Parliament, in that House of Assembly. Tonight, we don't have an MP in the studio, but we're talking about a bill, a very crucial, a very important bill to the generality of Zimbabweans, and that is the health bill, the public health bill. We understand that it has been crafted, it has been debated, and hopefully before this Parliament's term expires, will be pushed through to come into law. To help us get the contents of that bill as well as its importance, I'm joined in the studio tonight by an organization that surprised me, because I associate them with things that are completely unrelated to health, but nonetheless, Amnesty International Zimbabwe. My guest in the studio tonight is the campaigns coordinator, Roselina Muzerengi. Ma'am, great to have you on the program. Thank you for joining us.
Thank you so much, Farai.
Let me begin by asking you that. I mean, when people hear Amnesty International, I think the furthest, or certainly one of the furthest things from their minds is health and public health. So perhaps as a starting point, tell us, how Amnesty International is associated with this public health bill.
Okay, let me start by saying that Amnesty International is a human rights, it's a global human rights movement of people campaigning for human rights, and health is one of those fundamental rights. So that's why Amnesty is now being associated with the bill. And over the past few weeks, we have made a submission to Parliament around the issues of concern that we think Parliament should look into before this bill is passed on. And it's a landmark issue because we are working with the Public Health Bill of 1924. So for us, it becomes very important that we make our contribution. As you might be aware, that the bill has gone through the first and second reading, and in the next few days, it will be debated in Parliament before it can be signed. So we thought that we could take this opportunity to highlight some of the major concerns that we have around the bill before it is debated in Parliament in the next few days, like I've highlighted.
What are some of those concerns?
Okay, Amnesty International is concerned that certain provisions of the Public Health Bill are not consistent with Zimbabwe's human rights obligations as guaranteed in the Zimbabwe's constitution and by the international and regional human rights treaties that Zimbabwe has ratified. We have got three major concerns. One of them is that the bill fails to guarantee a human rights-based approach to health. It does not make reference, like I've highlighted, to Zimbabwe's international human rights obligations, and falls short of safeguarding the rights to non-discrimination, confidentiality, and informed consent. That's the first one. And then the second one is that the bill risks breaching adolescents' rights to access to sexual and reproductive health care services and information, because it implies that children under the age of 18 do not have the legal capacity to consent to health services.
Okay.
And then maybe the third one is that the bill retains, many problematic provisions of the 1924 Public Health Act and takes a punitive approach to the prevention and treatment of infectious diseases. it gives provisions around powers to health officials to enforce mandatory testing and treatment, isolation and quarantine, detention of people who are affected without any safeguards. So we are saying that the bill risks facilitating human rights abuses and violations if it is passed in its current form.
Okay.
Yeah.
We're going to come and unpack some of those issues one by one and obviously delve into more detail. And I know that Zimbabweans, when we talk about issues of health, obviously this is a very topical issue. We encourage you to get in touch with us, 0731 168 045. Send us a WhatsApp message. Give us your contribution. I think some of the key issues that certainly I can pick up here, and I'm sure one which will be very debatable, is this issue around, the rights of adolescents. You are saying if they are below the age of 18, they are deemed to, they can't consent to medical services. So does that mean that, anyone below the age of 18 must have a guardian or a parent who then says, look, I want my child to be treated?
Precisely.
A 17, 16-year-old can't walk into a health facility and say, look, I want treatment for whatever. It's something that perhaps I can't or don't want to divulge to my parents. That can't happen.
Yeah,
they don't have that privacy.
Yeah, they don't have that privacy, and they don't have that capacity to consent according to the bill. So that's why we are saying, if it is passed in its current form, that's the risks that it poses. Yeah.
In that event, so if a person below the age of 18 turns up at a facility and wants treatment, they'll be turned away if they don't meet that requirement of having an adult.
Yeah, when we look at particularly at sexual, reproductive and health rights services, issues around contraception, yes, that's what the bill is saying.
Okay.
Yeah.
Get in touch with us. I was going to ask further questions, but some of these are my personal opinion. I'm sure we'll get into them during the course of this program. Get in touch with us if you want to ask questions, and I'm sure this is a very critical point, because as it goes to be debated in Parliament, here's an opportunity for you to get some of the information about this bill, what it entails, what some of these contentious issues are, and perhaps as Zimbabwean, you may want to chip in, to contribute, and get in touch with your parliamentarian as they sit down and prepare to discuss this very crucial and important bill. My guest in the studio, just to remind you once again, is Roselina Muzerengi. She's from Amnesty International Zimbabwe, which has some concerns around this Zimbabwe public health bill. The violation of human rights, we've touched a bit on the issues of adolescence. The first, when you raise your issues that you have concerns about, is that it doesn't make Zimbabwe oblige to its human rights, international human rights requirements or its treaties that we've signed up to. What are some of those?
Okay, the Convention on the Rights of the Child is one of those. And then we also have CEDAW Convention on the Elimination of All Forms of Discrimination Against Women. Yeah, and the African Protocol on Human and People's Rights. So some of those are some of the regional and international conventions that Zimbabwe has ratified, and you find that the bill is not speaking to those international and regional commitments that it has made. Yeah.
Now, as MPs prepare to debate this, obviously, I think if we are trying to change a law from 1924, long overdue. There've been new diseases that have emerged. Medical care, health has completely changed in just the last 10 to 5 years, let alone almost a century. Why, in your view, has it taken this long? And do you think that there's now this urgency? Do you see this urgency in parliamentarians to make sure that this happens? Certainly, because we know that the lifespan of this parliament will soon come to an end.
Yeah, of course. I think it's really urgent. Why? Because the current Public Health Act is a colonial legacy, and our amendments are very vital to meet the public health challenges of the 21st century. So it is important and welcome that the Public Health Bill of 2017 aims to update Zimbabwe's laws relating to public health and ensure that they are aligned with the Constitution. So I think it's a very urgent issue, because like you highlighted that the health issues have evolved, and we've been working with the Public Health Act of 1924. So for me, I think it is a very urgent issue that Parliament needs to look into as urgently as possible, so that the bill is aligned with the current constitution.
One of the key things that I know is contained in the bill is that it refers to the right to access health care in Zimbabwe's constitution. Why is it so important to explicitly protect that right to health in the bill?
I think the right to health is very important. Why? Because it can inevitably affect other rights as well. For example, if young girls are not able to access, sexual, reproductive, and health rights services, and then they get pregnant in the process, what it simply means is that they are going to get pregnant. One, two, they're going to end up in an or forced marriage. They are going to drop out of school, and there can be complexities that come about as a result of having to carry a pregnancy when the body is not matured enough to be able to do that. There are a lot of complications that can come with that. So we're saying that the right to access to sexual, reproductive, and health services is very, very important.
What sort of reception are you getting from MPs or the people who are pushing this bill in terms of this input you are giving? Are they open to these sort of revisions?
Okay, we have made our submission and we have not yet gotten feedback, but we're just hoping that the recommendations that we have given to MPs, particularly the Portfolio Committee on Health, we've been engaging with Dr. Labode, who is the chairperson of the Portfolio Committee on Health, and they have welcomed, the recommendations that we have made, and we're just hoping that the recommendations that we have made will find their way into the bill, because from a human rights perspective, I think that will strengthen, the public health bill.
What does this bill mean because the reality that many Zimbabweans face is they go to a health facility, they are asked, do you have medical aid? If you don't have medical aid, pay us up front. If you can't pay us up front, we can't treat you, or we can't give you drugs. People have to pay for blood and all these, if they want transfusions and all these sort of things. So the reality many Zimbabweans face is that healthcare has become expensive, and if many of them don't have the formal health insurance products that can allow them to access that service, what does this bill mean to a Zimbabwean who is sitting in that position where they can't even go to a hospital because they don't have the money?
I think, thank you very much for your question, Farai. I think it's one of the issues that we have highlighted as a major concern, that, health should be affordable, and we are worried that the bill places obligation of payment and costs on the person treated and not on government. So the bill at times gives health institutions the power to take necessary measures to ensure that the patient settles the bill. So in the absence of further guidance or explanation, this provision may deter people in need of emergency from accessing services due to fear of costs. So we are also very worried about that component, that, the costs, for example, emergency cost around sexual, reproductive, and health rights is placed on the patient, and you find that some of them are actually detained before they can, before they are able to pay. So we are urging government to ensure that this bill places the obligation of payment on government and not on the patient, and that people should not be, detained because of failure to pay. So what it then does is that people then shun health institutions, and they end up giving birth in unsafe conditions, or in the home, which is not safe, and it can lead to maternal mortality. So
Indeed.
yeah.
But some of these health facilities, these hospitals, these clinics are saying, look, we need these user fees. Without this payment, we can't continue going on. We can't continue serving the very community that you want us to serve. Putting the burden on government, we know government will have its challenges, perhaps delays in payments. Won't that then compromise the very services that you want people to have access to?
I think that's the very situation that we find ourselves in. But we believe that it is the government's obligation to ensure that people can access health facilities. The duty to protect and uphold and fulfill human rights is the duty of government. So yes, there are certain, financial requirements, but those financial requirements should be met by government because the right to health is provided for in the Constitution.
True. One of the provisions I understand is that this bill ensures that no one can be refused emergency treatment. Is that correct?
Yeah.
And obviously you welcome that.
Yeah.
Why would someone under the current setup not be, surely if an emergency comes, you must attend to it and then seek issues of payment later. That unfortunately is not what's happening. So we hope that going forward, because what I've often found with legislation is that putting it on paper is one thing, application is a whole different ball game. So how do we ensure that once this bill, with the changes and all these improvements that you've spoken about, is passed, it's then implemented?
Okay, I think I think it takes us back to issues around budget. That the budget allocations to the Ministry of Health and Child Welfare should ensure that emergency services are accessed. So without prioritizing financial support to health institutions through the budget, then it becomes very difficult for people to be able to access these health services. So we are urging government to ensure that as they come up with with the national budget, preference is given to health, so that emergency issues around sexual reproductive health rights and other health rights issues are taken care of.
You talk about things Zimbabwe has signed up to but has failed to meet the Abuja Declaration. For instance, now that you're speaking about funding, I think African countries agree that at least 15% of their national budgets would go towards health. I don't imagine that there are any African countries that have actually been able to achieve that. So those are some of the stark, difficulties that are faced. It takes me back to a point that was made. I remember when the WHO had its meeting in Zimbabwe sometime last year, the Minister of Health from South Africa made, what seemed a very controversial statement to his fellow government officials from other countries, but I think is the reality, where he said, look, as long as the elites, as long as our leaders are not getting treatment in these very same facilities in their own countries, we will never get to that 15% threshold. So, I suppose you also want parliamentarians to be able to push and ensure that when finance minister comes, if there's no 15% for health, then we're not passing this budget. Yeah,
precisely. I would be happy if we would have such a parliament pushing for that. Whilst I understand that offering health facilities, offering health care is expensive. It needs a lot of financial injection. We would want to see, government progressively moving towards achieving the right to health, as ingrained in the Zimbabwean Constitution.
You've spoken about human rights, equal access, all these things. You've also mentioned that in its current form, the bill could potentially be discriminatory. Perhaps you could explain to us how so.
Okay, discriminatory. The non-discrimination is a human rights principle, and when we look in terms of this bill and health in general, discrimination can happen in the form of discrimination on the basis of age. Like in this case where we have the bill saying that children or girls under the age of 18 cannot access health services without a third part accompanying them. So for us it becomes discriminatory. It can be discriminatory on the basis of background and social standing, that you come from a poor family, hence you cannot access health services that are needed by even issues around health don't affect only the poor. It affects also the poor and the rich. But you are discriminated on the basis that you are poor and that you cannot afford health services. For us, it becomes discriminatory. And also discrimination can also be on the basis of sex. Particularly in this case, when we talk in terms of sexual, reproductive and health rights services and access to information, the girls are the ones who are mostly affected. Yeah.
Now, you, as an institution, as an organization, you seem to be very invested in this issue of adolescents' rights.
Yeah.
And in particular, girls, as you've just mentioned. Is this something, and I was going to ask you, are you specifically focusing on girls who are refused access to sexual reproductive health, or does this also cover boys? Because I would imagine they would also have instances in which they require treatment and all these sort of things. Is there something in the bill that specifically discriminates against girls, or is that just an area of interest for you?
Okay, maybe the background is that as Amnesty International, we have carried out a research. And the report came out around early this year, and we've carried out a research which actually focused on the barriers to access sexual, reproductive, and health rights services. So we discovered that it's the young women, women in general and girls that face these barriers in accessing So we are saying that the public health law must enshrine the equality of men and women as a first step towards rooting out stigma and discrimination that has caused so much harm, and this harm has affected mainly women and girls.
Indeed. Before we go to a quick break, listeners, do get in touch with us. 0731 168 045. 0731 168 045. Send us a WhatsApp message or call us direct. 0772 168 045. The Zimbabwe Public Health Bill seeking to replace the 1924 Act. Now, very quickly before we go, we also understand that one of the issues that you have as Amnesty International is that some of the provisions in this Zimbabwe Public Health Bill are simply copy and paste from the 1924 Act. What are some of those issues, and surely why are we doing that? It's so far back, it can't be applicable now, it can't be relevant.
Okay, yeah, I think that's one of the issues that I kind of highlighted. Like, it was just a copy and paste of the 1924 Act. Like I said, that it takes a punitive, approach to prevention and treatment of infectious diseases. For example, it criminalizes, issues around HIV and AIDS. And it also infringes on the right to privacy through enforced mandatory testing and treatment, issues around isolation, issues around quarantine and detention. So you find those conditions kind of prevent people from then going to health institutions so that they can access health services in the treatment of those diseases, because they are afraid of being isolated, they are afraid of being quarantined.
But if that is in the interest of the public, is that not something that should be done in the interest of the public, where perhaps a person has an ailment that could potentially spread and lead to an epidemic?
Yeah, precisely. If it is in the interest of the public, I guess it may stand like that. But you find that when you isolate someone and when you quarantine someone, it kind of strips them of their dignity from a human rights perspective. And it also affects other rights. For example, when a person is quarantined, when a person is isolated, they are then unable to maybe go and work for their families. So you find that in other countries, like issues around in Sierra Leone, they had such issues around Ebola. So, and they discovered that isolating people and putting them in quarantine actually prevented them from accessing health services. They would rather stay out there,
not known, so that they are not victimized or stigmatized. We're going to take a short break, and as soon as we come back, we're going to go through to get to some of the messages that are coming through. Keep them coming through. 0731 168 045. 0731 168 045. Roselina Muzerengi is my guest tonight. She is the campaigns coordinator for Amnesty International Zimbabwe. And we're talking tonight about the Zimbabwe Public Health Bill due to be debated in Parliament. A very crucial bill, a very important bill given the importance of health and some of the challenges that we've been facing there. So hopefully by crafting this piece of legislation, we can look to address some of those issues. Stay tuned. Ask the MP will be back very shortly. Welcome back. Ask the MP on ZiFM Stereo, my station, your station. You can catch us in Kadoma on 105.2, Kumakumoyo Kwamtari 95.4, in the city of Progress, Gweru 105.3. And in Mutorashanga 97.6 here, in Harare 106.4, and we broadcast live out of Newlands. Thank you so much for tuning in and for choosing us. I did promise we'll go straight to some of the questions that are coming through from our listeners. Keep them coming through. 0731 168 045. Quick reminder, we're talking Zimbabwe Public Health Bill. My guest in the studio tonight, Roselina Muzerengi. She's from Amnesty International Zimbabwe. Thank you so much. Charles Mauchaza in Ada Transao, thank you so much for getting in touch. He says, Sister Rose, ava vanofanirwa kupresenta nyaya iyi muparliament kuti our parliamentarians vanyatsoona kukosha kwemutemo uyu. Thank you so much for that contribution. And as Roselina has said, they have been engaging Parliament. They've made their submissions. They are yet to get feedback, but hopefully, we'll keep agitating. We'll keep pushing and calling upon our MPs to craft these laws that are in the interests of the generality of the people. And so that's why I'm encouraging you to ask questions and get information so you can take up your MPs on these issues. Prince Mutakaya in Sunningdale 2, thank you so much. He says, as we are all aware, the country's health sector faces numerous challenges: a shortage of skilled professionals and healthcare staff, an eroded infrastructure with ill-equipped hospitals, many lacking functional laundry machines, kitchen equipment and boilers, and a lack of essential medicines and commodities. How will this new bill cover all those issues and provide a better free health service? Does it speak to, I suppose it speaks to the funding side of it, but I suppose to respond to Prince in Sunningdale too.
Okay, I think Prince has raised very pertinent issues. That's why as Amnesty International we are calling for the government to ensure that the right to health includes the obligation to ensure that the health facilities, goods, services be known and be physically, economically and socially accessible to all. And they must also be affordable, for all individuals.
Mm-hmm.
Yeah.
Where affordable means what? Because that's a very, relative.
Affordable in the sense that it should not discriminate anyone on the basis of how much money they have, how much they can afford. Everybody should be able to access health services.
Mm-hmm. Flex in Borrowdale says, good evening. My contribution is that about our young girls being made to suffer after consenting to sexual activities and fall pregnant, instead of these human rights organizations educating our children to practice safe sex, not only to the girl child, but both girls and boys, because in this era we can't keep on singing about girls as if the boys are not relevant. Sometimes that's why some of these ideas are not taking time to be implemented, because they are discriminatory. So Flex is talking to that issue. We talked about it a bit earlier. I was saying, is it specific to girls that are suffering these sort of discriminations? But he's also saying, raising a point that we should also be talking about educating them about safe sex, preventive measures, as opposed to just, also I suppose we need to focus on all of them. So let's be preventive, but also not just focus on the girl.
Okay, I think he's making a very pertinent, observation. But maybe just to say that when we look at issues around sexual, reproductive, and health rights, research has shown that the greatest percentage of people who are affected are mainly women and girls. Not to say that boys and men should not access sexual, reproductive, and health rights services. And yes, I agree. We need to facilitate the empowerment of both boys and girls. I think it is very, very important, and we need to speak to having them accessing sexual, reproductive, and health rights services. For us, it becomes very important because the reality of the matter is that we may talk abstinence, but our research has also unearthed that young girls, adolescents are indulging in sex at a very tender age. So, as Amnesty International, we are saying that access to sexual, reproductive, and health rights services are a human right. And, they should be able to access these reproductive and health rights services so that, they do not run the risk, particularly girls. Girls are the ones who fall pregnant. They do not run the risk of having an unwanted pregnancy, which can lead to early child marriage. And then, we have, complex other human rights issues being affected because the girl has fallen pregnant, which also means that the girl may not proceed with her education. Mm-hmm. And the right to health is also affected.
Boxy from Sunning Hill in Blair says, honestly speaking, practically speaking, when there is need to quarantine, there is no violation of human rights because there is no other practical way to do it, is there? A question to you in terms of quarantining and whether that is indeed a violation. I suppose, coming back to the point, the question I asked earlier, where if it is in the interests, perhaps, there's nothing else we can do.
Precisely.
They must be quarantined, but yeah. So what do you do?
Okay.
Because I think you raise a very good point. Obviously, certainly people may feel that if I go, then I'm quarantined, those are isolate, and perhaps even going back into society, people say, they are quarantine you, we don't want to associate with them.
They are stigmatized in the process.
But as the listener from Sunning Hill is saying, if quarantining is what needs to be done, then that's what needs to be done.
Yeah, if quarantine is then what protects the right to health, maybe. But the quarantine, the isolation should uphold the dignity that is inherent in each and every human being. Yeah.
Exoneration from paying for services offered at our public health facilities is reserved for those 65 years and above, but statistics show that our life expectancy is pegged at 39. This bill needs to downwardly revise the threshold for not paying to at least 50 years. That is from Mozmandi Zhidza Kwasadza.
Yeah, he's raising a very important point.
Uh-huh.
Yeah, because you find, like he's rightly saying, that, the people are dying early, uh-huh. And that those who access free health services are those 65 and above, uh-huh. According to the current act Public Health Act that we have, uh-huh. And like I said before, it is the responsibility of government to make sure that anyone, regardless of their age, sex, gender, whatever it is, can access health services. So I guess it's making a very important point.
The burden, though, of being able to cater for, bringing that threshold, will it then increase the burden on government and perhaps make,
Yeah, of course it will bring, but it still remains their obligation.
Gwenzin Gweru says the biggest problem is that governments, especially ours, are prioritizing other issues and putting health at the back and expecting the donor community to foot it, when in actual fact health should be top of their agenda. Thank you so much for that, Gwenzi in Gweru. That's the point we spoke about earlier, the Abuja Declaration, where at least 15% must go towards health, and unfortunately that is not happening. We've obviously spoken quite a bit about some of the issues that you're unhappy about and issues you want to see changed, but this surely can't all be a bad law, a bad bill. What are some of the positives that have come through from your own observations?
Okay, precisely, there are quite a number of positives in the bill that we applaud the parliament for. The public health bill provides that a person cannot be refused emergency medical treatment. That is according to section 33, and as Amnesty International, we welcome that, and we also welcome the inclusion of human rights in the bill as a guiding principle of health policy and practice. That is a huge welcome. And also the bill also recognizes the constitutional right to have access to healthcare services, including the reproductive health care. So, yeah, of course, all is not lost in the bill. There are quite a number of positives, like I've highlighted, and we welcome those. But we remain with with concerns. Yeah.
Well, I suppose we are heading in the right direction. I think that is the most important thing, and if we are seeing these changes, and that's good. And going forward, we can always make improvements to this. I know that certainly one of the issues that I've heard raised in the past, and perhaps you could, if you are aware, shed more light on this, because I think again it comes back to the issue of access to health. Who should be getting it? I remember, women's groups agitating for a long time for maternal services, maternal care, labor, all these associated issues to be free, because they are saying, look, we are giving birth and we are doing a national service, I think they termed it. Does this bill in any way look at that issue of women who are giving birth?
Yes, it does, but the issue remains that access to health services, particularly maternal services, remains very expensive, and that we have situations where women after giving birth they are detained. So that remains a major concern for us. That this bill should ensure that maternal health services, they are affordable, they are accessible to women, because indeed they are doing national service. Yeah.
A bit of a different twist to what we've been talking about here. It may not be contained in the bill, but certainly as a rights organization, I'm sure this is something that you could perhaps look into or are dealing with, where we are saying everyone should have access to health, but there are cases where some people may not be allowed to access for various reasons. People believe, let's not go to the health facility. We've got other means of dealing with this, and so people are deprived access, perhaps by family, perhaps by people around them who say, look, don't go. Hospitals are not. I know of people who say, if I go to the hospital, then they believe in other means and other methods, and perhaps people may be deprived access through such instances. The issue we spoke about, stigma, where perhaps a family doesn't want it known that their daughter is suffering from something, and so they withhold and bar them from getting those sort of services. Is that something that is quite prevalent, and how best can that be dealt with? Perhaps not directly through this bill, but as a rights group, how do you deal with such cases and help such people?
Okay, yeah, I understand, there are certain belief systems, that prevent people from accessing, health services and information. And I would want to believe that it also is the responsibility of our government to come up with a massive human rights education to educate people on the importance of, going to health institutions and access health services. So I'd want to believe that human rights education becomes the tool that can be used to facilitate the empowerment of people, so that they know the importance of accessing health services, other than staying at home and maybe dying, yet they are there's a clinic that is nearby that can save their lives. So we call on the government to partner with different organizations working on health around human rights education, so that people are educated.
The deterioration in Zimbabwe's healthcare services coincided with the fall in demand for services through the introduction of user fees. These fees, which are often applied on an ad hoc basis, and they vary from provider to provider, and they act as a barrier to basic health services for many of the most vulnerable people in Zimbabwe. Don't you think the government must have a policy and duty to provide free of charge health services for pregnant mothers, children under 5, and those aged 60 and over? And I think that is already in place. Those sort of things are in place. And I think it's just a matter of ensuring that people who do go there demand that right. Because sometimes what you often find is someone will go and say, but I'm over 65, but at a particular, they'll say, it's at it, or, you still need to pay and things like that. So it's a matter of ensuring that people get what they're entitled to.
Precisely.
Education,
yes,
as you said.
Yeah.
Okay. Thank you so much to all those who are getting in touch. Keep those messages coming through. 0731 168 045. Zimbabwe Public Health Bill. This is what we're discussing tonight. It is due to be debated in Parliament. We are joined in the studio tonight by a guest from Amnesty International Zimbabwe, which is heavily invested in, this bill. They've made some recommendations in terms of some concerns that they have, particularly around issues of discrimination, making sure that everyone who would like to access, services gets them. Issues of minors, people below the age of 18. That, I would imagine, is a very contentious and debatable issue. Do you know if there's been the rationale, or has there been any justification, or perhaps it was just an issue of copy and paste as to why this issue of, people below the age of 18 cannot consent to medical services, to certain...
may you come again?
I was saying this provision that says that if you are below the age of 18, you can't consent to, say, for instance, reproductive health services, that you need a third party to accompany you. Is there any what was the rationale? Have you been told as to why that was put in place, or is it one of those provisions that was copy and paste from 1924?
Okay, I think it takes us back to the issue around inconsistency in our laws, that the age of consent to sex is 16, and then the
marriage.
Then the 18. At 18, that's when you can, when you're above 18, that's when you can access sexual reproductive health rights services. And yet at 16, you're already. So we were also concerned about that inconsistency in laws, because it is actually confusing when children below the age of 18 and those those that are 16 actually go into a health institution and they are told that below 18, so we can't give you. But at the same time, the age of sexual consent is 16, meaning to say that at 16 already, the young boys and girls are indulging in sexual activities. Yeah.
Indeed. So I think those issues of alignment, ensuring consistency, they are things that, they always come up, and we hope that certainly during this lifespan of this parliament, they can address all these issues of alignment of laws, so we don't have these double standards, for lack of a better term, which lead to these sort of challenges that you're speaking about now. I think very lastly, where to from here? We know if it's first reading, second reading, now it's due to be debated. From here, what next?
Okay, from here, I think as Amnesty International, as a campaigning organization or movement of people, we want to see a new public health act reflect, a strengthened human rights protection as in an evidence-based approach to protecting public health. We want adolescents to be able to access health services to protect their health and futures, including preventing child marriages that come about as a result of pregnancy. We want safeguards added to ensure informed consent and non-discrimination, and that marginalized people are protected. We want healthcare services, especially emergency treatment, to be affordable to all. And maybe last but not least, we want an approach to infectious diseases that is based on evidence, not punishment. Changes to ensure decriminalization of HIV are vital. We want to see safeguards added to ensure that the human rights and dignity of people affected by, diseases are protected.
Decriminalization. How is HIV criminalized?
Okay, there are issues around, purposeful infection of HIV and AIDS, and that, when it is decriminalized, then it helps people to access services. Yeah.
Well, thank you so much. I want to once again thank everyone who's been in touch with us this evening, and for sending all your messages on our WhatsApp platform. I know that many more were listening and tuned into this program. We certainly hope that you found value and got more information. I know that this is, as I've said from the beginning, it's something that is very important, touches every Zimbabwean, and I know it is a bill that is important for Zimbabwe. So we hope that it gets the attention that it deserves. We certainly have given this platform to start the debate, to start the discussion, to raise that awareness, and we look forward to revisiting it once the MPs are back and are debating it, to ensure that they are putting in there the provisions that meet with the changing dynamics of Zimbabwe. A very interesting point raised earlier about perhaps lowering the threshold of people who can access free healthcare, not just pegging it at 65, but realizing that the life expectancy has come down, and so perhaps those ages and thresholds might be revised downwards. So these are sort of the inputs that we want to get out of a program like this, which will shape and enrich the debate and discussion once it is happening in Parliament. And we thank you, Zimbabweans, for getting in touch with us and giving us this feedback and these insights. We certainly hope that you can continue to engage directly with your MPs and also with us on various platforms. Thank you so much to everyone who got in touch, who participated in this program. It's always great to hear from you. Thank you so much to everyone who listened. Thank you so much to my guest, Roselina Muzerengi. She's the campaigns coordinator for Amnesty International Zimbabwe. Thank you so much, ma'am, for coming through to the studio.
Thank you so much, Farai, for having us here.
And we wish you all the best. Certainly hope that some of the concerns that you have can be addressed, and that those inputs will be incorporated once the MPs are passing this bill into law.
Precisely. Thank you.
Ask the MP is only on ZiFM Stereo, my station, your station. We do it every Tuesday evening from 7:30 p.m. And as always, we want you to tune in, to have your say, to contribute and to comment, and many of you have already done so. Up next is Health Matters. You can stay tuned to that and a whole lot more. It is ZiFM Stereo. Once again, my station, your station. Do enjoy the rest of your evening's entertainment. Good night.